The service is available. Will, thanks for being with us.
Yes, just glad to be here.
Tell me about some of the challenges that you face.
Yes, so we recognize that there's a great stigma that is placed on mental health, which causes for an increase in individuals who aren't susceptible to reaching out for services. So our biggest goal is to make sure that we're providing that advocacy and that support, and that we're being a voice for those who don't feel that they have one.
What are some of the challenges that you see that Black Americans are faced more so than white Americans, and why do you think that is?
Yes, well, we know that poverty level affects mental health status, and Black Americans living below the poverty level, as compared to those that are twice at that poverty level, are twice as likely to report psychological distress. And we also recognize that suicide is the second leading cause of death for Black Americans ages 15 to 24.
That's unbelievable. I did not know that. Is there a greater stigma within the Black community about going and seeking out help?
Yes, it is seen as a sign of weakness in many. And, I try to combat that by making sure that I'm using my platform to promote the importance of seeking help. And recognizing that there are different signs and symptoms and something is going on that's affecting my everyday living. It's a sign of hope, a sign of strength in being able to understand that, well, there is help out there and it's okay to not be okay. And also that, you aren't alone. There are so many people who are experiencing those same signs and symptoms, and there are also a lot of people who are on the other side of things, and they've received the help and they're using their voices as we're doing today.
So how do we work to lower the stigma, and how do we get the word out to people that these resources are available?
Yes. I think it starts with how we talk about it. When we're having those conversations around the table or even with friends, are we stopping to check and ask our friends that are normally, okay, are we just saying, hey, how are you? How are you doing? Are we recognizing that there's a way to stop asking, well, what's wrong with you, to children, and start asking, well, what's happened? And be able to offer help, by saying, hey, I'm here to help you. I'm not here to hurt you. Our biggest goal is to make sure we're getting the word out via outreach and awareness and education. So you're able to contact us via our 1-800 number, but also by checking us out online, you're able to see the numerous resources that we offer as an agency across the state of Tennessee.
Do you feel like things are improving at all, Will?
I think things are improving because of moments like this. I appreciate you all for taking the time to highlight mental health as a news station, because there are a lot of people that are watching that weren't aware that Tennessee Voices existed, but also people that are now probably like, wow, it's okay to talk about it, and it's okay to not be okay, and here's a way that I can reach the goals that I've set forth for myself.
Will, thank you so much for your time. This is such an important conversation, and we appreciate the work you're doing.
Yes, thank you all so much.
Yeah, thanks, Will.